This is a series of vignettes presented by the Pacific AIDS Education and Training Center, which role models the interaction between an oral health provider and an HIV positive or at-risk patient. These scenes depict opportunities to engage in HIV risk assessment and prevention. Adherance vignette. This is a 20-year-old man known to be HIV positive. Learning objectives. Role model how an oral health provider could discuss adherence with a patient. Consider barriers to adherence. Consider how to overcome barriers.
Hi, George. How you doing?
All right.
I haven't seen you in a while. How are things going?
Going all right.
All right. And how's the HIV? How's that going?
It's going.
It's going. Okay. All right. You've been seeing your doctor on a regular basis?
Yeah.
Good. When's the last time you saw him?
9 months ago, I guess.
9 months. Well, then that's not quite as recent as you were supposed to see him, huh?
Well, I just got a job. It's hard to keep taking sick time like all the time, you know. They're gonna be like, oh, why are you always sick? And I don't want to lose a job when I just got it, you know. So.
Well, that's great. You got a job. I'm glad
you have Saturday hours. That's the only reason I'm here. So.
Oh, yeah, those Saturday hours. But well, anyway, congratulations on your job.
Thank you.
But I'm a little concerned that you're not seeing your doctor on a regular basis. Most HIV patients need to be seen by their doctor every 3 to 4 months because your doctor will follow your medications, follow the virus, see if the medications are still working. And if they're not working, then, switch the medications. So I think it's really important that you keep your appointments. Do you think that you might be able to maybe start work a little late and go see your doctor? I know of a clinic that has weekend and evening hours. And they see HIV patients. I've got some patients who go there. Would you be willing to do that?
Yeah. As long as it's confidential, I guess.
Your boss is not going to find out by the clinic. If you want to tell your boss, that's your business. Okay? So before you leave today, we'll give you the phone number for that clinic, okay?
Yeah.
Well, I see here from your assessment that you're on your medications for your HIV, and I think these are the same ones that you were on the last time I saw you. Mm-hmm. So when did you start these? How long has it been?
A year.
Okay, good. Are you tolerating them all right?
Yeah. I get an upset stomach sometimes,
Well, a lot of patients have trouble taking their medications. For you, on the average, or let's say in the last 2 weeks, how many times have you had to skip or you forgot taking your medicines?
I guess I have missed a few times. Like when I'm at work, if it gets busy and they don't give me a break, then that messes me up for like the rest of the day. And then sometimes before I go to sleep, or like I'll fall asleep and I don't take that nighttime one. Or other times I'll just forget, one of the.
Well, George, I understand that it can be really hard to take medications, especially if they're causing you problems. But it's really very important to take your HIV medications on a regular basis. Otherwise, the virus will get resistant to it, and then they just won't work anymore. I would really urge you to talk to your doctor, and sooner rather than later, about this problem. Because, some of these new medications, they don't have as many side effects, and your doctor might be able to switch you to the newer ones. And some of the medications only have to be taken once a day. Or they might find that that nighttime dose that you said that sometimes you skip because you fall asleep, maybe it doesn't have to be taken at night, maybe it could be taken in the morning. So there might be some very easy ways to fix this problem. So I really urge you to talk to your doctor, get those regular appointments, and be taking your medications on a regular basis. Okay, George?
Okay. Yeah.
All right, great.
Thank you.
You're welcome.
But just curious, but why do you care if I take my pills or not?
How do you answer the patient's question about your interest in his medication adherence?